We are back here on Girl Talk, and we are at the new Kaiserling Cancer Center here at Beaufort Memorial Hospital. And I'm really excited to talk to you. Delores Mann, thank you for joining us. Dr. Jonathan Briggs, thank you very much for joining us. And we just did a segment a few minutes ago about heart disease, and now we're focusing on women's health and breast health. So you are a recent breast cancer survivor, and we really appreciate you taking time to share a little bit about your story with us. And Dr. Briggs, thank you, because I think it's a time that's unsettling for many of us when we're diagnosed, or even with breast health, just the anticipation. So it's really interesting to get someone who can actually talk about what's going on. Delores, can you share with us a little bit about your story?
Yes. I went in for my annual mammogram.
Good girl.
Yes. I do that. You know, it's in my family, but I've never worried about it. But they found something and did an ultrasound and decided they needed a biopsy. So I got with a surgeon and then found out that it was breast cancer.
Okay.
And when I got the call that it was breast cancer, although I was not worried about it,
sure,
I was in total shock because I really didn't think it would happen to me.
And that's probably pretty typical, isn't it?
Very common.
Well, let me ask you a question from that point moving forward, and Dr. Briggs, you might be able to share and have insight. Is there then a team approach? Once this diagnosis is made, what is the protocol? How do you as the patient, I'm sure you're not thinking as clearly as you could be.
Oh, no.
How do you all work as a team?
Well, yeah, we do a very nice thing here at Beaufort Memorial. We have a breast navigator. It's a nurse,
Awesome.
a nurse that helps guide the patient. What we try to do when the diagnosis is first made is we have the patient meet with all of the possible members that could be involved in her care.
Okay.
That would include the surgeon, of course, the radiation oncologist, myself, and the medical oncologist. And we basically meet with the patient, go over all the different options and possibilities. We then attend a tumor board together, all the doctors and nurses and all the team members, and then we present back our recommendations. So we believe this approach allows the patient to get the best possible care and with less anxiety.
Was that helpful for you?
Totally.
Okay.
And when the nurse navigator was assigned, she went with me to every appointment. She would call me, she would explain to me what the doctors had just told me, and if I had any questions, you know. But it was awesome, the fact that all my doctors knew what was going on.
Which is fascinating.
Yes.
So then she was actually another set of ears for you.
Oh yeah.
An objective
yes.
set.
Yes.
So once the decision's made, your decision was to have a lumpectomy?
Because they did genetic testing.
Okay.
And genomic testing. And the genomic testing is on the cancer itself. And they decided, he said, suggested the lumpectomy, which I was fine with. Because even though I had it in my family so much, I tested negative for the BRCA gene,
So then she comes to you for the radiation oncology. What does that protocol look like? And I understand that you've got amazing equipment here at the Kaiserling Cancer Center.
We're very proud of our brand new equipment, the latest and greatest of the linear accelerators, which provides the best possible care for someone dealing with breast cancer. But the actual course of therapy is different from other types of treatment. Radiation is a daily treatment.
Oh.
And usually people are in and out of our department in 15 minutes.
Okay.
We're very proud that we're usually right on time, which helps.
Well, you said it was, Delores said it was a positive experience.
And as you can imagine, coming here every day for several weeks of treatment,
yes,
you can get to know our department very well, and that's, I think, one of the strong points that we have here is the people and the care.
Developing relationships in a time that can be really stressful, knowing that you've got people who actually care probably is really impactful.
Yes, very helpful.
And so what happens? You go through different regimens of the radiation?
Well, it's a daily process, depending on what part of the body we're treating, in this case the breast. and the person would receive a very quick treatment each time, and it's designed to gradually just wear down and kill the cancer cells while still preserving good body tissue.
So what happens? It's probably wonderful in you're in a facility now where everything is together. That has to be an advantage too.
The new cancer center just recently opened, and we're going to have basically all the different modalities of cancer care here, which would include the radiologists, the surgeons, the gastroenterologists, pulmonologists, medical oncologists.
All
I
under
could go
one
on
roof.
and on, but
exactly.
Women's health is very, very strong here, and we pretty much, we really promote it, as a big part of our plan here.
So moving forward for you, what happens now?
Actually, I see him. I finished. So I see him next week, which would be a month after my last radiation treatment. And I'll see my oncologist in 3 months, and they'll do they'll keep a really good check on me.
Very close follow-ups. The first few years, mammograms on a routine basis, blood work, physical exams, of course, is the utmost importance, and we just really monitor our patients.
So it's almost like, in my world, LA world, it's almost like having high blood pressure or heart disease or diabetes or something, where now you sort of manage it like a chronic disease.
Exactly. That's the ultimate goal, is that when someone has cancer, it becomes a chronic disease rather than something that's more scary than that.
Thank you both for joining us here today. And ironically, our next segment is going to be with our nurse navigator, so we're excited about that. Stay with us here on Girl Talk. There's more to come. To reach the Kaiserling Cancer Center, call 843-522-7800. Again, 843-522-7800.